Bronchopulmonary segments. What is the definition of these bronchopulmonary segments? These are well defined, not ill defined, not the point. Anatomic, functional, not non functional. Okay, and surgical sectors of lung, which means it has an association with surgery. Okay, so well defined, anatomic, functional, and surgical sectors of lung. So if someone tells you it is an ill defined, non anatomic, non functional, and non surgical sector of lung, you should correct them. It's false. Okay. The each one aerated by a tertiary or segmental bronchus. Okay, each bronchopulmonary segment is aerated by a tertiary or a segmental bronchus. Each segment is pyramidal in shape. Each segment is pyramidal in shape, with its apex directed towards the root of the lung. What is the shape? It's pyramidal. Okay, with its apex. Okay, with its apex directed towards the root of the lung. Okay, next point. Each segment has segmental bronchus, segmental artery, lymph vessels, and autonomous nerves. Okay, so each segment has its own segmental bronchus, segmental artery, autonomic nerves, and lymph vessels. Segmental The segmental venule lies in the connective tissue between adjacent pulmonary units of bronchopulmonary segments. See, there is a connective tissue between adjacent pulmonary units of bronchopulmonary segments. The segmental venules lie in the connective tissue. Okay. The sixth point is during segmental resection, the surgeon works along segmental veins to isolate particular segment. It is the surgical importance of this segmental venule. Okay. During segmental resection, the surgeon works along the segmental veins to isolate particular segment. Okay. Relation to pulmonary artery, relation to pulmonary vein. Branches of pulmonary artery accompany the bronchi. The artery lies dorsolateral to bronchus. The artery lies dorsolateral to bronchus. Relation to pulmonary vein. Pulmonary veins do not accompany the bronchi or pulmonary arteries. They run in intersegmental planes. See, the pulmonary artery accompany the bronchi, but the pulmonary veins do not accompany the bronchi. It's the differentiating feature. They run in intersegmental planes. They run in intersegmental planes. The artery lies dorsolateral to bronchus, and each segment has more than one vein, and each vein drains more than one segment. Each segment has more than one vein, and each vein drains more than one segment. This is a very important point. What is mentioned here? When we take a segment, the segment has more than one vein, and each vein drains more than one segment. Okay, you should remember this point.